What is the first line treatment for anaphylactic shock? Correct answer is option B, epinephrine. Which of the following is a hallmark sign of hyperthyroidism? Correct answer is option C, tachycardia. Which drug is most commonly used to treat acute asthma exacerbation? Correct answer is option A, albuterol. What is the most common site for a pulmonary embolism to originate from? Correct answer is option C, deep veins of the legs. A 35-year-old female present with a butterfly-shaped rash over her face, which autoimmune disease is most likely? Correct answer is option B, systemic lupus erythematosus. Which of the following is a characteristic finding in diabetic ketoacidosis? Correct answer is option C, Kussmaul respiration. A patient with a history of congestive heart failure is prescribed furosemide. What is the primary effect of this drug? Correct answer is option D, increases urine output. Which of the following electrolyte imbalance is most commonly associated with the use of diuretic? Correct answer is option B, hypokalemia. What is the most likely cause of pain in a patient with diagnosis of acute pancreatitis? Correct answer is option C, inflammation of the pancreas. What is the recommended diet for a patient with chronic kidney disease? Correct answer is option B, low protein, low potassium and low sodium. Which of the following is a common side effect of opioids? Correct answer is option C, constipation. What is the correct sequence of actions when performing CPR on an adult? Correct answer is option A, chest compression, airway breathing. Which of the following is a priority in the care of a patient with a suspected stroke? Correct answer is option B, maintain airway patency and oxygenation. A 50-year-old male is being treated for peptic ulcer disease. Which medication would be prescribed to decrease gastric acid secretion? Correct answer is option B, pantoprazole. Which of the following medications can cause a life-threatening condition known as agranulocytosis? Correct answer is option C, clozapine. In which of the following conditions is a strawberry tongue commonly observed? Correct answer is option A, scarlet fever. What is the first symptom that a nurse should assess for in a patient with a potential myocardial infarction? Correct answer is option B, chest pain. What is the most serious complication of untreated acute glomerulonephritis? Correct answer is option A, chronic kidney disease. Which of the following is most commonly used to treat a patient diagnosed with atrial fibrillation? Correct answer is option A, anticoagulant. What is the primary method of preventing hospital-acquired infections? Correct answer is option B, proper hand hygiene. A nurse is caring for a patient with a leg wound. Which of the following actions would best promote wound healing? Correct answer is option B, elevating the leg above the heart. What is the primary function of the kidneys? Correct answer is option B, filter and remove waste product. In the case of a burn injury, what is the most important factor in determining the severity of the burn? Correct answer is option B. Which of the following is a complication of a prolonged use of corticosteroids? Correct answer is option B, osteoporosis. What is the primary purpose of administering digoxin to a patient with heart failure? Correct answer is option C, to decrease heart rate and increase contractility. Which of the following is most commonly associated with a low serum albumin level? Correct answer is option A, edema. What is the primary cause of hypertension in a patient with chronic kidney disease? Correct answer is option A, increased blood volume due to sodium retention. Which of the following findings is characteristic of hyperkalemia? Correct answer is option A, muscle weakness and heart arrhythmia. A patient with a history of gout present with sudden pain and swelling in the big toe, what is the best initial treatment for this condition? Correct answer is option A. Which of the following best describe the mechanism of action of beta blockers in the treatment of hypertension? Correct answer is option B. What is the priority nursing intervention for a patient who is experiencing an acute myocardial infarction? Correct answer is option B. Which of the following is a contraindication for the administration of the pneumococcal vaccine? Correct answer is option A, a history of a severe allergic reaction to a vaccine component. Which of the following is a sign of hypothyroidism? Correct answer is option B, cold intolerance and dry skin. A patient present with sign of fluid overload including weight gain, edema and crackles in the lungs, what is the most likely cause of these symptoms? Correct answer is option D. Which of the following drugs can increase the risk of bleeding in a patient receiving warfarin therapy? Correct answer is option C, aspirin. A nurse is preparing to administer an intramuscular injection to a patient. Which of the following sites is the most appropriate for this injection? Correct answer is option B. Which of the following is a risk factor for developing a deep vein thrombosis? Correct answer is option B, prolonged immobility. Which of the following findings is characteristic of acute renal failure? Correct answer is option A, decreased urine output and increased serum creatinine. What is the most appropriate nursing action when caring for a patient with a history of seizures? Correct answer is option C. Which of the following conditions is commonly associated with a tunic or spider veins on the legs? Correct answer is option B, varicose veins. A 45-year-old woman is diagnosed with osteoarthritis. Which of the following interventions would be most effective in managing this condition? Correct answer is option B. Which of the following is a primary symptom of meningitis? Correct answer is option B. What is the priority nursing action for a patient who has sustained a head injury? Correct answer is option A. A patient present with blood pressure reading of 190 over 110. What is the most appropriate initial management for this hypertensive emergency? Correct answer is option B. What is the most appropriate intervention for a patient experiencing a tonic-clonic seizure? Correct answer is option C. What is the first action the nurse should take when a patient with diabetes shows signs of hypoglycemia? Correct answer is option B. A nurse is assessing a patient with suspected pneumonia. Which of the following signs would suggest that the patient has developed a pleural effusion? Correct answer is option B. Which of the following is the most appropriate nursing intervention for a patient with a nasogastric tube who is experiencing nausea and vomiting? Correct answer is option B. A patient who has just undergone a thyroidectomy is at risk for which complication? Correct answer is option A, hypocalcemia. Which of the following is a common side effect of the anticoagulant warfarin? Correct answer is option C, hemorrhage.